in the theme of put up and shut up, we're going to show you the card for our next presenter, which is Dr. Beth, and she is going to talk to you about the fact that you do not have to put up and shut up. This was our theme that we called it from yesterday. It was we just had so many providers talking about the myths and the idea that's out there that like, oh, when you're pregnant, you just have to deal with nausea the whole time, or you can't use acupuncture to treat it, but you can. Or when you're pregnant, you're going to have back and hip pain and you just have to deal with it for 9 months when you could get treatment for it. And Dr. Beth is going to talk to us about some pelvic floor health and how when you're postpartum, whether it's immediate or 5 or 10 or 20 years later, you can still get care so that you don't have all those things that are the stupid internet memes, the like you sneeze and you pee.
So I have been on Instagram updating people who's next and stuff. And so the thing I shared from Sound Body Physical Therapy was leaking urine when you laugh, sneeze, or jump is not normal.
Yes.
The number of times I've gone into parent Facebook groups when people are like, it's normal. I'm like, hold up. It is common.
Yes.
It is not normal. That is not your function. Get help.
Yeah. Oh my gosh. We're getting real riled up and we're going to invite Beth to come be riled with us.
Come be riled. Beth is not riled. Beth is calm.
No, Beth is very calm, but I'm excited to hear her. She's passionate in addition to being calm. And I'm excited to hear her talk about how it isn't the way that it has to be and you can get some help. So Beth, whenever you're ready, if you just turn on your camera and unmute your mic. Hello.
Hello. Technical challenges.
Happens. You look great. You sound great.
Thank you. So fun to be here again.
Yeah, great to have you back. We're going to let you do your thing.
Thank you. Thank you guys for putting all of this together again. I know it takes a lot of time and it's such an awesome resource. I'm really happy to be included here again, and it was really good to just listen to Dr. Molly. And I had NICU twins, and Molly was a huge resource for us. Because when you have 2 babies, sometimes you don't have side preference options and such. So I can't say enough good stuff about Dr. Molly. But I'm Beth, and I work with Sound Body Physical Therapy. I'm a physical therapist, and I specialize in pelvic floor health. I actually started working in neurological rehabilitation with an elderly population, and I found it really striking how many of the older women were incontinent and simply said, well, I had babies, like everybody is. So the short story is over time, over a few years, it pulled me over into orthopedics and a passion for specializing in women's health and pelvic health. That it doesn't have to be the norm, as Sarah and Olivia said, that there's things we can do around the time we have babies so we don't spend the next few decades wearing pads or avoiding activities we want to engage in. And incontinence is commonly talked about, but it's only one small part of pelvic health and wellness. Not everyone that I treat has had or will have a baby, but since it's the parent trip, I'll focus my time here today. My goal is to help you and your body navigate growing, delivering, and then caring for a tiny human, as well as taking care of yourself along the way. So just a small task. A few things I'm going to cover today are: what does it mean to specialize in pelvic health? Who should consider seeing a pelvic health physical therapist? And what might you gain from working with me? So what does it mean to specialize in pelvic floor health? As a physical therapist, I'm your movement specialist. I focus on whole body health and wellness, how you move and interact with your ever-changing environment, and goodness knows your environment changes when you add a baby to your life. In terms of pelvic health and wellness, I've done advanced and specialized training to assess and treat the pelvic floor and associated body parts. I work with people across the prenatal and postpartum spectrum, and I take a closer look at how those muscles relate to the rest of the body and functional movement. The pelvic floor has a lot of really important functions, supporting your abdominal organs like your bladder, your uterus, your bowels, coordinating with your core muscle, and supporting the rest of your body. A few things I focus on include muscle weakness, overly tight muscles, incontinence or leaking urine, round ligament pain, abdominal separation, cesarean recovery, pain with intimacy, postural changes, pelvic, hip, or low back pain, because we know it's all connected. There are a whole lot of tiny muscles down there, and some pretty big ones too, that do really important things for us every day, and they deserve attention. We're also really aware when those muscles don't function how they should, not how we expect them to, and it can be a little hard to talk about, and it especially can be hard to know where to go to get help. There's a lot of sort of brushing it off as it's normal, or give it some time, or wait a few months. So during an appointment, I talk with you about your concerns, your complaints, any goals, specific questions you may have. Then we take a look at how you're moving, walking, nursing, carrying your little one, sleeping with your little one, and any movements that just might not feel good. From there, we look at the strength and mobility of individual muscles, how specific joints are moving or maybe not moving, and how any possible incisions or scar tissue are healing. One really common question I get is, are Kegels good for me? And that's an awesome question, and the answer is maybe. Sometimes they are, and sometimes people hold a lot of tension in their pelvic floor, and those tight muscles and the Kegels actually make their symptoms a whole lot worse, so it can be pretty confusing. It's really, as Sarah and Olivia said, it's really, really important to differentiate between normal and common. It's super common to leak a little urine after having a baby. It's common to have abdominal separation, but it doesn't mean that it's normal, and it doesn't mean that it can't be worked upon and improved. So as a pelvic floor physical therapist, I incorporate what's going on in your pelvis and your pelvic floor with the rest of your body and your movements as you are recovering. Who should see a pelvic health physical therapist? Anyone who's currently pregnant or has been pregnant, and that can be someone who was pregnant or had a baby 6 weeks ago, or someone who had a baby, 60 years ago. Once you're postpartum, you're always postpartum. Your body has been through that. I think PT is really underutilized around pregnancy. Someone sprains their ankle, they strain their hamstring, they hurt their knee. People don't think twice about going to PT, and they go a couple times a week until they're better and back to their sport. Yet pregnancy has this huge impact on our musculoskeletal system, and birth is a really big event, no matter how the baby chooses to enter the world. It requires recovery at many levels, and it's appropriate to get some support. So I think it's important to recognize that every journey is different, but it is absolutely safe to say that your musculoskeletal system is going to be challenged in ways it hasn't been before and after birth for quite some time. And it doesn't matter if it's your first or your third pregnancy, it's still a challenge to your system. It really varies from person to person. I love to see someone a few times when they're pregnant to get to know you and your body, address any pain, concerns, talk about the things you can do to continue feeling good while you're pregnant, and what you can do right after your little one arrives. It's really good to go over that while your brain is somewhat rested and clear. And we're talking about some small things to help your body start recovering, and then things to keep your eye out for. Things that might be signs you could benefit from treatment or evaluation sooner. Are you feeling heaviness in your pelvic floor? And if so, what does that mean? What should you do about it? Is it concerning? Are you leaking urine and it's not getting better? How are you sitting when you feed and hold your baby? Does it feel okay? Sometimes we get into some pretty funny positions to feed a baby or to get them to sleep. I can certainly vouch for that. Postpartum, I see people anywhere from a few weeks to months or years later. 6 weeks is often a really good time. At that point, we can do a thorough pelvic floor evaluation, get a few simple exercises, make sure you're able to safely increase activity levels, do any problem solving with nursing or feeding positions, carrying babies, different baby carriers, sleeping, anything that you really need assistance with. And then I also tend to see a lot of people about 3 months postpartum. You're feeling better, you're getting out, starting to be more active, and suddenly like, this feels different. And sometimes different is okay, but sometimes different could use some assistance. So there's really not much to lose. Some people come in for 1 or 2 visits and touch base, and they're doing great, make a few changes. And then some people come in more frequently and for longer durations of time. So what might you gain from working with me? Lots of knowledge, hopefully feeling better, some individualized tips for moving functionally, safely, and minimizing pain. Altered movement and pain tend to go hand in hand, and pain can be exhausting. Parenting is exhausting, at least it is or was for me. And so you don't need that double whammy of trying to take care of this new being, and trying to take care of yourself and being tired from pain. During pregnancy, there's many obvious changes to the body and some subtle ones as well. Postural changes, weight distribution changes, ligament laxity, changes in muscle length, just to name a few. Your pelvic floor muscles stretch 30% during pregnancy. That's huge. Can you imagine if your bicep or your quad muscle was stretched 30%? It wouldn't be very functional. So some of those things continue while nursing. And we also know that the demands from the babies just keep increasing as they get bigger. So some things I focus on prenatally are staying active and strong, minimizing pain, any appropriate supports, belts, pillows, that kind of stuff that can keep you feeling good. Tips for taking care of your pelvic floor in the early postpartum period, and the end of being pregnancy. How to have a bowel movement post-baby. That's not scary. It's a big one. And then postpartum, I focus on strength and integrity of the abdominals, pelvic floor function, and muscle re-education if needed, like a proper Kegel. Any muscle or joint pain, checking for diastasis or an abdominal separation, and showing you how to not make it worse and hopefully how to make it better. Scar tissue, healing from cesarean or tearing. We look at incontinence and bladder retraining, addressing any pelvic pain, looking for prolapse, checking in with breastfeeding positions and carrying recommendations, and getting back to the things you love to do. So to wrap this up, listen to those little aches and sore muscles and come get help soon so you can keep caring for yourself and your little one. Don't wait too long. It can be really hard to prioritize yourself in those early days, but it's super important. And the good news is there's a lot of small things you can do that add up to big changes over time, which also means there's some small things we do repeatedly that get us into positions of not feeling so good, like carrying positions or breastfeeding. I'm a super active person. I always have been. I've always filled my free time with moving and exercising. And I have twins who just turned 2. My body grew those babies, has cared for them since, and my movement profile is crazy different. I still get a lot of activity, but it looks different, and that's okay. I think it's really important to reach out to other practitioners, many of whom you've heard from today, for support. I'm a PT and I have the information, but I desperately needed that support pre and postpartum. You don't have to figure it out on your own. You really don't. So consider consulting with a physical therapist if you are currently pregnant or if you've ever had a baby. If you have any concerns we've talked about today, or if you just want some specific personal information about your body and movements. Lastly, I guess, what do appointments look like? They do look a little different right now, changing as our current health environment does. We have a mix of in-person and telehealth, and telehealth has actually been really surprisingly good. Lots of great feedback. We're a small clinic. For in-person visits, we have 3 therapists. We're just having 1 therapist in the clinic per day, spacing between patients, all the windows open, and a lot of safety precautions. So we do bill insurance. We accept cash payment, cash pay wellness appointments. We're happy to check your benefits and see what makes most sense for you. Often deductibles and out-of-pocket maxes are already met with the delivery. And so often PT doesn't cost anything, which is kind of nice. So don't hesitate to reach out if you have questions or think you might benefit from working with a PT. And with that, I'll turn it back to Olivia and Sarah. Thank you so much.
Thank you, Beth. It was really nice to see you.
I will pull up Beth's info for y'all.
Great. Oh my goodness. So much good stuff.
So much.
I really love the way that she talks about how you're always postpartum.
Right?
Yeah. Beep, beep. Beep, beep. Thanks for watching. If you liked our channel, please make sure that you hit the button at the bottom and subscribe so you don't miss any other videos we have coming up.
If you want to know the moment we post, hit that bell to notify you.
Ding, ding. We're also on Facebook and Instagram.
At the Parent Trip PDX.
And we have a Patreon that we'd love you to check out.
We do all of this for free. We love to support you. We love to share all these resources. But it would help us out a lot if you came and gave us a little support so we can keep doing what we do.
Thanks.